Back as promised here on Local 6 Midday as Family Health Experts continues with Dr. Jared Anderson of Audiology and Hearing Center in Paducah and Murray. And before we get into any specific questions for today, hearing loss is something, Dr. Anderson, that is normally associated with those of us who are getting elderly, but we should know that it's not something that usually happens all at once. Hearing loss can be gradual. So what are some of the signs that people and or their family members should be wary of when someone is losing their hearing?
Certainly. So hearing loss does occur very often, very gradually, so gradually that many times an individual may not realize that they have a hearing loss or be aware of the severity of that loss. You know, friends and family, they can be looking at if that person is complaining that people are mumbling, if they're having difficulty carrying on a conversation on the telephone, if they're having trouble with women and children's voices. They typically notice that first before they start noticing difficulty with people with deeper voices. If they're turning up the TV, radio louder than other household members, those are all signs that it may be time to have that hearing evaluated.
So as couples get older and the wife complains that the husband just doesn't hear her or isn't paying attention to her, it may not be that he's not paying attention. It might be because the frequency of the pitch of your voice, he just doesn't hear it, right?
Absolutely, yes.
Okay, so now what are some of the causes of hearing loss that people need to be wary of?
Yeah. So, very commonly we see hearing loss related to age, also known as presbycusis. Hearing loss can be caused by noise exposure. This could be occupational or recreational noise exposure. Certain medications can cause hearing loss, and certain health issues and diseases can cause hearing loss.
So when you talk about diseases causing hearing loss, any specific diseases that we should talk about?
Yeah, so ear infections, probably one of the most common causes of hearing loss. There's also a lot of research going into relationships between hearing loss and things such as diabetes, cardiovascular disease. A lot's unknown, but it's an area that's always coming out with new research looking at the relationship between the two.
We have a question from Roger who says, I am on several types of medication for a heart condition. Should I be proactive and have my hearing checked?
Certainly. If you have a history of cardiovascular disease, as I mentioned, it's not directly related at this time, but research is showing the relationship between the two. By having a hearing evaluation, you can establish a great baseline. That way, if or when you do experience a change or a hearing loss, it's going to be monitored and tracked and treated right away.
Have about 40 seconds left here, Dr. Anderson, and you mentioned hearing evaluation. Is that the same as a hearing test? And if not, what's the difference?
Yeah, so we do comprehensive diagnostic evaluations because as doctors of audiology, we want to know exactly what the type, cause, and severity of that hearing loss is so we can administer the most appropriate treatment.
He is Dr. Jared Anderson of Audiology and Hearing Center, Paducah and Murray. And if you're having concerns with your hearing, you're welcome to call and set up an appointment and have that hearing checked. If you would like to review this segment, give us just a little bit of time and we'll post it online. Look under Family Health Experts at WPSD Local6.com.